Hi guys, it's Nicole Jones from the Physio crew, and today I'm going to talk to you a little bit about shoulders. Now, I don't know if you know, but my special interest is shoulders. I absolutely love them. They're brilliant because you get really quick feedback. Now, a lot of the shoulder pain is actually coming from the neck, so we need to, when we're assessing people, look at the muscles within the neck, look at the nerves, and see whether there's any referrals. So to work out whether the nerve is involved, what we do is we look at the clinical history, we ask whether there's pins, needles and numbness, which is a fairly good indication that the nerve is involved. And then we do something called upper limb tension tests, and that helps us to, before you go Googling these, they can make it very irritable. So if you're going to try to do them yourself, just be really careful because it can irritate it. So we would do specific testing to see whether the nerve is involved, and then we would actually look at the shoulder itself. So I often use something called the shoulder symptom modification score, and it's a bit controversial in the physio world, but I tend to think that if a patient walks in with pain and then they walk out with no pain, that I've done an okay job. So I'm going to stick with what's been working for me. So the sort of things that we do with that, I'll just show you some of the exercises we will look at doing. Is we'd start by looking at whether if we change where your cervical spine is, whether that changes the shoulder pain. And that gives us a good indication that it's probably not the shoulder. If we change the neck and that changes the pain, then it probably is going to be more related to the neck itself. And so we would concentrate our treatment on the neck. The next thing we would be doing is looking at scapular retraction. So that's the shoulder blade, retraction and protraction to see whether that changes the symptoms. And the reason for that is the position of the scapula can affect the position of the humeral head underneath in the joint itself, and if there's any compression of those soft tissues, that sometimes causes pain. So then we would look at exploring different parts of the shoulder. So we might look at the different muscle groups. So we could isolate the muscles by keeping the elbow in, pushing the hand out, pushing the hand in, and we can look to see whether we think the supraspinatus, that's the little muscle up here, the rotator cuff one that often is a problem. It's becoming more common now that we actually talk about rotator cuff tears rather than isolating the muscles, because they merge together. We actually tend to call it a rotator cuff tear, but we can try and work out which fibers are affected, and that would change the exercises that we prescribe. This is one of the really common things that I see at the moment, unfortunately, because of the pressures on the NHS. A lot of the GPs will say, look on the internet and you can find the exercises. But in the last week, I've had 3 people who, unfortunately, they've gone and tried exercises because they were completely not specific for that patient's problem, and it's made it worse. So if you've been experiencing that, stop the exercises, go and see an expert, and then hopefully we'll be able to help. It's really important that you look at the way the muscles are working together. So they work sort of in a coupling, they work together to keep the humeral head in the right place. So sometimes actually it's not a strength issue, sometimes it can just be that one of the muscles is more dominant and firing quicker than the other one. So that's another thing that we look at, the timing of the muscles. We also look at the thoracic spine, so the upper back. So one of the things you could try if you've got shoulder pain is you could try very gently to turn. Now, keep the shoulder in a neutral position. Don't bring the shoulders up to here, because depending on what you have wrong, if it's a frozen shoulder, for example, it probably won't like that. So keep it down, move from left to right, really twisting through the thoracic spine. That might allow more blood and oxygen in and around those the joints and just where the nerve comes out in the neck. And again, that might be enough to free things up. So the top things that I would try is see if the neck position changes it, see if the thoracic position changes it, see if shoulder position changes it, and then if you're still stuck, pop me an email, nicole@thephysiocrew.co.uk, and I'll try and answer any questions. As I always say, it doesn't matter if you're in Scotland, it doesn't matter if you're in a different part of the country. My aim is to help people, so pop me an email, and if I can't help through an email, then I'll pop you over to someone who can help you. Hope that's been helpful, guys.